Alrighty, so before we start, I'm just going to frame it really quick with kind of like a goal. So we want to help you recognize the challenges in the lives of trans people and be empowered to become an informed and respectful ally that can use their cisgender privilege to create change. There might be a lot to take in. This whole presentation might be a lot to take in. If you don't know what those words mean yet, we're going to get there. Don't worry about it. So we just have a few quick ground rules for creating a safe space. We want this to be a place of learning for everyone. So because of that, no question is off limits for the purposes of this presentation. We want to kind of save any trans people you might meet in the future from having those conversations if they don't want to. So I'm willing to have those, and I'm an open book, so feel free to ask. Along with that, and the guarantee to be honest, is that there is going to be some sensitive content that might require some respectful reactions. Realize that this is, the reality of some people's lives. And then also with that, if you need to step out at any time, we're going to try to trigger warning throughout where it's applicable. Feel free to step out without fear of judgment. And then a disclaimer, I'm not an expert on everything trans related. I'm just a trans person with life experience under my belt. And then I also speak from the perspective of being a trans masculine person and from my age, race, and socioeconomic background. Cool. So we have this little chart here about why this is important. Some of the main takeaways: 30% of trans women have been incarcerated. 50% of trans people have been assaulted by a romantic partner. And trans women of color have a 1 in 8 chance of being murdered. So just some of the more shocking statistics facing our community. Alrighty, so we're going to go into some basics. Gender versus sex versus sexuality. It is very basic, but it's also a very large topic. So when we're talking about gender, we're talking about someone's gender identity. So an internal sense of being male, female, both, or neither. And then this is separate from gender expression, which is presentation and the culturally specific way that you're read as masculine or feminine. Sex, we're talking about a medical assignment. It's usually based on your genitals at birth. The doctor kind of makes a sweeping declaration of it's a boy or it's a girl. And then when we're talking about sexuality, we're talking about someone's sexual or romantic orientation. This can include labels like lesbian, gay, bisexual, heterosexual, queer, etc. So we're going to have there's quite a few terms, but some of the more important ones to know. So when we're talking about someone who's transgender, this can be an individual identity or an umbrella term, and it's used for people whose gender identity differs from what is typically associated with the sex they're assigned at birth. So somebody who identifies under this umbrella term may use other subcategories such as genderqueer or non-binary. And so some trans people will undergo a transition, a medical transition, and some do not. So it's more of a broad kind of category. When we're talking about someone who's transsexual, it tends to be a little more specific. It's frequently somebody who is undergoing a medical transition. It's used to be seen as sort of derogatory, but over time it's been pretty thoroughly reclaimed, and so it's still an identity that some people hold. When we're talking about someone who is non-binary, binary, just breaking it down, binary refers to our sort of Western gender binary system of man and woman. And then non-binary people will identify outside of that. They might not identify as a man or a woman, or perhaps something in between, or neither. And so it's a fundamental understanding that there are identities outside of this man-woman dichotomy that we've set up. Genderqueer is similar to non-binary, but it is distinct. It's usually used by someone who does not identify as male or female, or who identifies with multiple genders. Gender fluid is somebody whose gender identity moves between genders or fluctuates. So for them, it's not a static, sort of static thing. It's a process, and it can shift and ebb and flow. A cisgender person, so this is the term that is not under the trans umbrella. A cisgender person is somebody who identifies with the sex they were assigned at birth. You're born, doctor looks at you, says it's a boy, and the rest of your life you're like, yep, that's right, it is a boy. And so that's a cisgender individual. An agender person might feel that they have no gender identity. So this is something, once again, seeing outside of the sort of Western conception of everyone falling into a man-woman dichotomy. Intersex is more of a medical term, and it's for somebody whose reproductive or secondary sexual characteristics do not fit typical definitions of maleness or femaleness. When we're talking about drag, this is something that it can get to be kind of a gray area as to whether or not it's under trans umbrella, but typically these are cisgender individuals who are dressing and acting for an entertainment purpose. So this is distinct from somebody for whom this is their personal identity. If you take away nothing else from today, the number one thing is to respect pronouns and names. So that's a real, just basic sign of respect. So if you're an ally, whatever that person asserts is their name, it is their name. Whether or not it's legal, whether or not it's on their birth certificate, that's their name. And then when we're talking about pronouns, that's obviously includes he, she, and then also other pronouns such as they or z, whatever makes the individual most comfortable. So here's a little picture of sort of what terms can fall under the trans umbrella and which ones do not. And so that's down here. You can see that for this purpose, drag is not considered necessarily as trans, nor is cross-dressing. But yeah, it's big umbrella. A lot of different ways to identify. So here we're looking at pictures of different relationships. And what we want you to sort of take away from each of these relationships is if you knew that one member of them was trans, do not start instantly making assumptions about what they call their relationship or what they define their sexual orientation as. So the physical body or history of these individuals should mean really nothing to you in terms of defining what their relationship is. It's really important to not be conflating people's bodies with their identities and allowing couples to define their own relationships. So if Bob and Anna identify as a heterosexual couple, but Anna happens to be transgender, they still have every right to identify as a heterosexual couple. And then similarly, in the case of, say, Raquel and Tan, perhaps Tan identifies as non-binary. And if you just walk up and you're like, oh, they're lesbians or something, that could be, very hurtful and completely disrespects who they are as a couple. Alrighty, so we're going to try to breeze through transitioning as much as possible just because it's a little bit shorter today, and it's not the number one thing to be an ally. Respect is most important, but just to kind of give you an idea of what can happen in the lives of trans people. Okay, we're not going to launch the video. Alrighty, so we're going into how or why someone knows they're trans. Everyone knows at a different point in their life. It can take place as a journey of self-discovery or kind of just an aha moment. It's personal for everyone, and no way is less valid, and it needs to be respected. We do know that children tend to have a sense of their gender identity as early as 3 or 4 and can identify sort of the permanence of that. Also around that age, they can identify gender-based stereotypes. So once again, going back to the way that our society is constructed, they already from the age of 4, kind of have an idea of what is acceptably masculine or feminine for them. So when we're looking at what causes transgender identity or transsexuality, there is a debate over whether it is a mental or physical condition. Currently, it is in the Diagnostic and Statistics Manual, which is used by psychologists to diagnose. So it used to be gender identity disorder, and it's now listed as gender dysphoria. So the subtle distinction there is actually really important because now what they're saying is the issue is not with the person's gender identity. We're not pathologizing someone's gender. That's not what's wrong. What's wrong is the dysphoria or that discomfort that they might feel in their body, in society, in the way people treat them or perceive them. And so that's more what we're trying to address. And for a lot of the medical transitioning process, oftentimes you will need a psychologist letter diagnosing you with gender dysphoria. Not always, there's some informed consent processes, but that is something that a lot of people have to go through. There are some emerging studies about physical differences or some biological basis for transsexuality. They've noticed that a number of sort of hormone and androgen markers in male to female individuals are closer to that of cisgender women than they are to cisgender men. However, these are all very early studies. It's a small sample size. It's something that people are just now beginning to be comfortable talking about, underfunded, and so we don't know a lot about the physical reasons that it might happen. For some people who are trans, they really identify with it as just a biological thing, as a medical condition. They don't feel like it's a huge part of who they are. They might not want to be, a part of the trans community, and they just want to move on with life. That's totally fine. And then some people really view it as a personal identity, and it's important to them. In my case, for example, that can be a process as well. When I started transitioning, I didn't want to talk about being trans. I just wanted to be male, and I just wanted to move on with life, and I didn't want this to be, a defining factor. And now I'm at the point where I wouldn't necessarily say that I identify just as a man. I would identify as a trans man because I think that that's really influenced my experience and who I am as a person. So it just depends, and it can change over time. Alrighty. So for many, social transition is the first step in their journey. It refers to the way an individual begins to present themselves as who they are and their changing role in society. So if someone has come out to you and told you they're transitioning, it's important just to listen. Listen to everything from how they're feeling to what steps they need you to take to make them more comfortable. Realize they've trusted you with an incredibly important truth about themselves. Some basics: don't ask them what made them decide. That's not what they're saying at all. They're saying that that's who they are. It's not about a decision. And from this point on, you have to take special care to not out them. So by telling someone else that they're trans, unless they expressly give you permission, you could lose their trust at the least, and at the most you could put them in great danger. So that kind of covers coming out. They might start going by a new name, as we kind of addressed earlier. It's important to respect that. Do not give them input on it. This is something that we've seen happen. Like, unless they ask your opinion, chances are they've taken a lot of care selecting it and it means something to them. Please don't ever say that's not your real name. That individual has the right to define what their name is, full stop. They may start dressing differently in a way that sort of matches their gender identity. They may change their pronouns. They may change the way their hair is. There are different tucking and binding, different ways to sort of shape bodies that have been affected by puberty to more match. So like in the case of binding, we're talking about like compressing the chest on a transmasculine individual to give a more sort of male appearing, XY male appearing physique. And then they can also change legal documents. So this is different based on what state you're in. But here in California, you can change everything, right down to your birth certificate. So driver's license, social security, all of it, the name and the gender can be changed on all of those documents. So some trans people might decide to take hormones. Not everyone will pursue it. The decision is personal and valid. And it's oftentimes cost prohibitive for people as well, because it's not always covered by insurance. California is trying to take some pretty major and progressive steps that it is, but that's not the reality for everybody. So some people have questioned giving trans youth hormones because it can affect their future fertility. And they say, to me it seems ridiculous to have a trans kid at age 12, 13, or 14 deciding whether they want to have biological children when they're 20, 30, or 40. And Dr. Johanna Olson, who is the head of the trans youth clinic at Children's Hospital Los Angeles, I think very aptly replied, well, they make the decision to kill themselves at 12 and 13. And I think that's a really important thing to just sort of let sink in for a moment and realize that this is in some ways, for some people, is a life or death sort of process that they're going through. So as we said, or I kind of touched on, for trans youth that do get treatment before puberty, they'll give them hormone blocking medications known as Lupron. It's a shot. And what that does is it just essentially stops time on their physical development. So that way they have time to think about what they want to do moving forward instead of going through a puberty that does not match their identification, which can cause a lot of problems later in life. So this makes their process a lot easier. If they decide that they don't want to go forward with cross-sex hormones, they can get off the Lupron and go through puberty as their body would have anyway. And so it's completely reversible and safe, and it's used all over the world at this point. So for transmasculine individuals, we have it listed as female to male and male to female. Anybody can use it. They don't necessarily have to identify it that way, but it's just to kind of break it down and help you understand the different processes. So testosterone is taken by an injection because it's too hard on the liver to be processed orally, and it puts the body through sort of a stereotypical male puberty. So there's going to be increased musculature, body and facial hair, acne and skin roughening, changes in appearance of the genitalia. The reason we say that is because, yes, I have been asked if you grow a penis from testosterone, so we're just gonna handle that now. Firstly, it's nobody's business, but secondly, it's not what you would typically say is XY genitalia. For that, surgery is needed. But there are changes, and that's between that person and whoever they want to be seen naked by. And then there's also going to be fat redistribution, so away from the hips and chest. And it will stop the menstrual cycle as well. So in trans feminine individuals, we're looking at a combination, anti-androgens to stop testosterone production because it's a very aggressive hormone, and then also estrogen. It can be taken in a variety of different ways, but I've frequently seen it taken in pill form. So there's going to be fat redistribution to the hips and to the chest, loss of muscle mass. The facial hair will come in slower and finer. A lot of times, though, if you want to get rid of it entirely, there's a process of electrolysis. So once again, another costly, painful, and otherwise inconvenient procedure in the lives of trans women. The skin will soften, and there is some breast growth as well. Alrighty, so we're gonna just quickly, trigger warning, we are gonna be talking about bodies and surgery and all that good stuff. So if at any point you're uncomfortable, feel free to just step out. Also, just as we wrap up hormones, I want to reiterate that there are also changes that we can't necessarily see. So right, we just quickly covered some of the physical changes, but there's, it's puberty. It wasn't fun the first time, it's not fun the second time. There's emotional changes, changes in libido, appetite changes. It can be a lot to deal with, both for the trans individual and their loved ones and the people around them. And so just understanding that and have a little bit of patience with us. Shannon was with me as I went through my early stages of transitioning. I was insufferable, but it calms down eventually, I swear. Don't even worry. So when we're looking at chest reconstruction surgeries, there's two forms. There's double incision. And so it's just on a very basic level, it's a double mastectomy, so it's going to leave scars from about here to here on either side. Or if the individual has a smaller chest, periareolar can be done, and that does not leave any scars at all, actually. So kind of just depends. The reason I decided to cover surgery and talk about scars is because I actually had an experience once where I took my shirt off and someone who knew I was trans looked at me, saw my scars, and goes, "So that's what it looks like." Please don't say that. Please don't say that. So that's why we're going there. We're just giving you that information now. Bottom surgeries that are available and not always pursued by everyone, but can be. There's a hysterectomy and oophorectomy to remove the uterus and the ovaries. So internally, that's what can be done. Externally, there are two surgeries. There's the phalloplasty, which uses skin grafts to create I will say a penis, but obviously we know that that's a very broad and subjective term. So a penis in the sort of more traditional sense. And then metoidioplasty, which does not use skin grafts and just kind of rearranges what is already there. So those are two things that could be pursued. In trans feminine individuals, there are facial feminization surgeries for those who want them. This can be things like the cheekbones, etc. Tracheal shave, which is the shaving down of the Adam's apple. Breast implants, if they prefer. And then bottom surgeries would be an orchiectomy, which is the removal of the testicles. The important thing about the orchiectomy and the oophorectomy is it removes the part that produces the hormone that isn't wanted. So that can be sometimes useful in the transition process as well. They can lower your dose then and everything. So oftentimes it's recommended by doctors, but it's in no way required. And then there's also the vaginoplasty, which involves the inversion of the penis to create what would typically be perceived as a vagina. Most importantly from the surgery section is if you've just met Liz, you wouldn't ask her about her genitals, and you shouldn't if you knew she was transgender. And it happens way more than you would like to know. So there is a lot of emerging legislation in regards to trans individuals, some that are recent and in California. We have AB 1266, which is the School Success and Opportunity Act. What that does is it allows transgender students to access the gender-segregated spaces of their identification. So trans girls can play on, say, girls' soccer teams, and trans men can use boys' bathrooms, things of that nature. The opposition arguments are that it puts cisgender children at risk, that they are unsafe sharing bathrooms and other areas with trans people. The reality is school districts such as San Francisco and LA have implemented this policy in their districts for years and have never heard stories of trans students assaulting cisgender students in these spaces. It's not something that really happens. This is a scare tactic. And the fact is you have probably safely and unknowingly shared these spaces with trans people throughout your life. And then there's also AB 1121, and this simplifies the process of a name change and a petition for the change of name in the state of California. So originally, you had to publicize your name change in a newspaper, which is not only expensive, but also incredibly invasive and can be unsafe when we're talking about a society that is filled with rampant transphobia. So with AB 1121, the public reporting aspect of it is taken out, which sort of can expedite the process. So just going into how to be an ally and what's respectful and what's not. Allies do not say any of these words. Allies do not ask people what their real name is, comment on if they feel that person looks like a man or a woman, use the wrong pronouns or make assumptions. This is one too. Why would you transition if you're going to be gay? Firstly, allies just don't ask that. But to answer that question, in case there is a concern, gender identity and sexual orientation are completely distinct concepts. So who that person is romantically or sexually attracted to is in no way affected by who they are as an individual. Allies do ask someone for their pronouns and name. That's the best way to go about it. If you're unsure of somebody's gender, not going up and just being like, "Are you a boy or a girl?" The most respectful way to do it is to just discreetly ask them what their pronouns are. And so we kind of covered over there some transphobic language that can be used. I want to quickly address the T slur, which is found up there. This is something that you might hear people in the LGB community use and feel that they can use, particularly when we're looking at things like, RuPaul's Drag Race, things of that nature. It's important to not take that as permission to use it. LGB individuals, cisgender LGB individuals, do not get to decide what is and is not hurtful to trans people. So just making sure that that you don't hear members of the community use it and go, "Oh, okay, that's an okay word. That's a word we're using now." It's not. Well, it is for some people, but only for the trans people who are okay with that. So we're going to trigger warning really quick. We are going to go into physical harm and some transphobia. So hate crimes, 78% of K-12 trans students report experiencing harassment. 35% of that is physical assault. 92% of hate crimes committed against trans women in LA County are of a violent nature, and that came from a report in 2012, so it's definitely still happening. And that compare that to 79% of hate crimes about sexual orientation are violent, and 61% about race. Abuse, 15% of K-12 trans students left school due to persistent harassment. 90% of trans people report having experienced harassment at work. 25% report being fired. And 57% of trans people report experiencing significant family rejection. So then when you're looking at sort of the obstacles at school and at work, that's when you then see these statistics come in about 20% of trans people experiencing homelessness, 11% being evicted, 41% attempting suicide. and things of that nature. So there's the often quoted 41% attempted suicide rate, and compare this to 1.6% of the general population will attempt suicide. There's also medical abuse. 28% of trans people have postponed medical care due to discrimination, and 48% have had to delay it because they can't afford it. So once again, going back to this starts all the way from school and work and has these ripple effects on the rest of their lives. 19% of trans people report being refused medical care. This is actually something, there's a documentary called Southern Comfort, and it is about a trans man who actually died of uterine cancer because he lived in the American South, and every doctor that he went to get treated would not treat him because he was a trans man. They said it would make them and their patients uncomfortable to have him there at a gynecologist's office. 2% of trans people have been victims of violence in a doctor's office. And medical providers knowing a patient's trans status increase the likelihood that discrimination will occur. So frequently, when trans people are dealing with medical professionals, they don't want to be out for various reasons, because it can be unsafe to be out. It can also be unsafe to not be telling your doctor these things because it's important in terms of your care, especially if we're looking into specifically reproductive care. So issue, but it's not all awful. We're going to go over some important figures in trans history. A lot of times this isn't something people talk about, but trans people have always been here and they have always been contributing. Cool, thank you. To a variety of rights movements. So Christine Jorgensen was one of the first openly transgender people in the United States, and she underwent a very public sex reassignment surgery or gender confirmation surgery, depending how you prefer to call it. She gave many public interviews in the 1950s. Sylvia Rivera is a transgender activist and witness to the Stonewall riots. She was a founding member of the Gay Liberation Front, Gay Activists Alliance, and Street Transgender Action Revolutionaries. Lou Sullivan is the founder of FTM International. He's an author and a founding board member of the LGBT Historical Society. Another thing that was important about his writings and contribution is he really publicized his life as a gay trans man. And at the time, it was very unheard of. In order to transition, doctors had to feel like you were going to be straight. That was actually a part of the diagnostic criteria for a while. Bambi Salcedo is the president of the Trans Latina Coalition, the creator of the Angels of Change calendar, national speaker, and she's a nationally recognized HIV and AIDS and transgender activist. She also, up until very recently, was on staff at the Children's Hospital of Los Angeles working with their program. Bailey Bauschbaum is a former Olympic pole vaulter, came out as trans in 2008, so there are definitely trans people present in athletics as well. Laverne Cox is an actress best known for Orange is the New Black. She's the first openly transgender person to be nominated for a Primetime Emmy, and then she's also gotten quite a respected reputation as a speaker on trans issues. So being an ally, what is an ally and what do they do? A passive ally, we're talking about somebody who, they support and they're trying not to be actively oppressive and maybe they're accepting. But an active ally is somebody who's really willing to take that extra step and speak up, as long as it's safe, obviously. And so they're willing to have those conversations at home and at work and supporting those protections for trans people and participating in educating and community events like this. When you're responding to bigotry and transphobia, make sure that you're not outing anybody. If you're in a group setting and someone says something transphobic, you don't want to be like, Sky's trans, you can't just say that. Keep that, you might want to keep it a little more general. Just be like, that's a transphobic comment, here's why. Engage in conversation calmly, and know how to refer people to credible sources. So things like the Transgender Law Center, et cetera. So just getting those resources to refer out. In terms of building community and support, in Long Beach, we have the Center Long Beach. I'm going to keep plugging them, work very closely with them. There is a trans support group there. We run trans ally trainings there, and just in general, it's a good resource for local queer individuals. And then there's also the Transparent Families group at the center, which is for families of young children who are sort of gender creative or gender diverse. So a lot of resources out there. Reach out. And for all of those of you who know Shannon, Shannon also works with a lot of those groups and can help with resources. Alrighty. Thank you. Does anybody have any questions?
Also, you can keep going.
Okay.
We told other people that they could go over, so you can go over too.
Okay. Well, I just buzzed right on through. So if questions, discussions, thoughts, feelings, revelations, new pronouns, anything. Oh, we're good. We're good. We're done. That's all.
I feel like I should ask a very leading question.
I know,
well,
Shannon.
I can't think of one. Could you just go a little deeper into accessibility to medical transition resources and how a very leading question indeed, and how difficult it is for low-income people and often people of color to get access to what is life-saving resources. Okay.
Yeah, no, absolutely. Yeah, that's we cut out the video slide just for the sake of time, but that is something we usually talk about. So a lot of times when you're seeing these stories in the media of these, happy, shiny trans people transitioning and everything's awesome, you're often seeing a very specific type of story, which is white, upper class, heterosexual, binary trans individuals that are getting these resources. And so this is something that, once again, it's a factor that then leads to this, sort of just institutionalized oppression against trans people is that those aren't available to everybody. And this can also affect, so if you're not getting the medical care you need, if you're not getting the transition resources you need, such as surgeries and hormones, you might have a harder time passing. You might have a harder time being seen as your gender in society, and this puts you at a greater risk for violence, right? If people can detect that you are trans, you're at a much greater risk. And so that's something that we see sometimes in especially lower income communities and trans women of color. It can also be difficult to access medical care if you don't identify strictly binary as a man or a woman. If you're a non-binary individual, explaining that to a doctor and sort of getting through the gatekeeping and getting a doctor's consent on what you can and can't do with your body and what is and isn't an appropriate identity, is a huge hurdle for those communities.
That really answers my question.
Okay, we're good. Yeah, we're done.
All right, well, thank you
We're
guys
done.
for being here. One more time for Sky.
No.